Hello, everyone,
Yes.
and welcome to
About that.
today's edition of Red Talks on COVID-19. Today, I'm talking with the Iraqi Red Crescent, Dr. Yassine Abbas. If you haven't actually seen one of these Red Talks in the past, we've been doing them since the end of March. One of our first ones was on psychological first aid. We've also had the Italian Red Cross volunteers on. We also did a Red Talk on COVID-19 on Earth Day. And on Earth Day, we talked about how COVID is being, how COVID has affected our response to the climate crisis. So we've talked on many subjects, and today I'm actually joined by the Iraqi Red Crescent, and we're talking about how our response to COVID might change in complex environments. So welcome, Dr. Yassine. Thank you so much for joining us today. Oh, I think his internet is...
Thank you for inviting me for this session. Thank you very much.
Yeah, so I want to remind our audience that this is a conversation, so please comment below if you have any questions. And if you don't have a question and you just want to say hi, please tell us where you're watching from. Just, comment the country or the city that you're watching from, and we might give you a shout out. So thanks so much. So my first question for you, Dr. Yassine, is can you give us an overview of what is the situation right now in Iraq?
Yeah, thank you very much. And good evening, everybody, I think, or good morning in some places, I don't know. But in Iraq, and thanks God, we are relatively have a small number of cases. And till now, we have reached around 2,500 positive cases of COVID-19. The death is not more than 100 cases. And I think we are, let us say, lucky, but I think the early measures which has been taken to combat this pandemic was very helpful in countering the increase in number. And we managed to, in these cases, with of course, with the cooperation of the people in following the health instruction, that would be very helpful in limiting the number also.
That's really great. So maybe you can talk a bit about, we talked about this earlier, and actually you have a really interesting point. So Iraq is facing continuous turmoil aside from COVID, the COVID pandemic. Has there been any, maybe you can talk a bit about how this has affected the volunteers' response to COVID?
Yes. We used to be in the demonstrations and places and locations since last October, and we have distributed our first aid providers, ambulances, and our doctors even in these areas which witnessed a big demonstrations. And definitely that was a response to the needs in these areas. But that influenced the security situation, and that has something which is not expected, a positive impact on the spread of the disease, on limiting the spread of the disease in Iraq, because, there was some security challenges. And we used to have millions of pilgrims whom they visited the holy places in Iraq. And due to this security, the number have been reduced by more than 95%. And all of us, we know that now it is well known that this disease is spread from one country to another. So the small number of foreigners in Iraq limited the transmission of the disease to Iraq. So I think that was unexpected positive impact on limiting the number of cases of COVID-19. And I'm sure that the first case was transmitted from a visitor from a neighboring country. And many other cases, it was the same. It was an imported pandemic for Iraq. It's considered imported, and it arrived to Iraq from either Iraqis whom they visited countries, neighboring countries, or many other countries, or from foreigners. That was one of the main transmission ways for that disease, I think, which is well known worldwide now.
Huh, that's really interesting. You wouldn't think that it would have some sort of an effect like that. So that's really interesting to know. And what about, so maybe you can talk a little bit about what has the response from the Iraqi Red Crescent been? How have they been responding on the ground through their volunteers to the COVID crisis?
Yeah, actually, we responded this pandemic when we used to have 0 cases. We started a big campaign for population awareness regarding the individual hygiene and for social distancing and for the best ways to prevent the pandemic. And we, in the early days, we used to use the direct contact with the people in educating and organizing the education campaigns. And we almost reached 1 million of Iraqi people through the direct education campaigns. Then we moved to the social media and to the different medias to disseminate the culture of prevention and combating the disease among population. And by this way, I think we reached more than 8 million population by this way. So, and that was the first phase. But when the cases starting to increase in Iraq, we launched the second phase, which include, in addition to the population awareness campaign, we started the sanitization campaign, which included public places, included prisons, hospitals, government buildings and offices, private companies, markets.
So Red Crescent's going in and sanitizing all of these areas.
I think we reached, I have a big number in here. I think we reached more than 22,000 locations by sensitization. Yeah, and this campaign is still going on. And the third phase, which we launched around 3 weeks before now, it was for supporting most vulnerable families by distributing the food parcels, because we recognized a high need for food support among the most vulnerables whom they lost their income because of the lockdown, because of the drop in the oil prices in Iraq. You know very well that Iraq is very much dependent on the oil revenues for running its economy, and unfortunately there is an unprecedented drop in the oil prices, and which is let us say 95% of the income in Iraq come from the oil revenues. So I think that was a negative economic impact on many families, and that's why we launched the third approach, or the third phase for our response, which include distributing thousands of food parcels for those families, and we still on this phase. And I think we will launch the fourth phase next month on June, which will include free healthcare delivery services for those most vulnerable, whom they cannot afford, of course, the private practice fees, or those who have no access anymore to neighboring healthcare institutes because of being closed, either closed or being confined to receive the COVID-19 cases.
So what does that mean? Does that mean that they can get free testing for COVID, or is that for any sort of healthcare services?
No, we will, you see that, because usually many people in Iraq, the health services are free, and it's usually delivered by the public hospitals or health centers. But many these public hospitals, you have usually a long waiting list.
Yeah.
So this waiting list is now, I think it's get longer and longer. You should wait longer time to have an access for these services, the public services. And that's why now, because of COVID, because many hospitals now, they are just being allocated to receive COVID-19 cases, not regular medical consultation. That's why now we will start next month opening our hospitals and health centers to receive those patients for free also, to support this group of families whom they cannot afford waiting for a long time or paying the fees for the private. That's why will be our next phase in delivering these health services for the people. And also we will deploy our mobile clinics in rural and remote areas to deliver these services and there directly to the people.
That's really amazing. That sounds like you have, the 4 phases sound like they've been really, really effective. I'm wondering though, how has it been with the communication with the public? Are people willing to physically distance, or has it been hard to have that conversation with people? Are people out on the street and trying to continue their daily lives, or do they understand how important it is to try to physically distance?
There was a long curfew was imposed by the public authorities or by the government from the 19th of March, and it lasts for around 40 days. And that was, of course, that was very successful in limiting the dissemination of the disease among the population, one of the main. And so the people, but that was not very well respected in certain places, unfortunately. And that's why you see that now in these places, there is a bigger number of cases than those whom they respected this curfew.
Yeah. And has the Red Crescent had
from the beginning, the problem that sorry. Has the Red Crescent had any role in public awareness of the importance of physical distancing? Yeah, we produced cartoons, we produced many tips, clips, and we distributed through the social media, through the TV, through many ways of media to the population. And I think we have a great positive response with our media campaign for the population. That's why you can, as I mentioned, we have been reached more than 8 million of population through these publications. And that was a very successful, I think, very successful campaign for Iraqi Red Crescent in supporting the public authorities in this, in combating this pandemic.
So if you've just joined us, we have people watching from Ghana, Pakistan, United Kingdom, Indonesia, Jordan. I'm going to read through them all because I want to appreciate everybody that's watching. Nepal, Egypt, United States, Spain, Belgium, Australia, India, Zambia, Bangladesh, Japan, Nigeria, Malaysia. You're famous, Dr. Yassin. And I'm talking to Dr. Yassin of the Iraqi Red Crescent on their response to COVID-19. So I want to go to one of the listener questions. It is from Krishna on Facebook, and she'd like to know how the lockdown has affected people during Ramadan. Have there been any challenges that people have had to face?
The lockdown very much eased during Ramadan. There was 24-hour lockdown before. Now it's only 12 hours. Okay, and the people, of course, during Ramadan, And there is an additional measure which has been taken in limiting the number of the people in certain places, and they close all the mosque or and that was very helpful in limiting also the number and for gathering, and they banned all the gathering more than 5 in everywhere. So that was also very helpful in limiting the disease. Yeah.
So that all the mosques are closed. Now the lockdown's only for 12 hours. So is that during the day or is it at night?
It's usually from 5, the lockdown is from 5 p.m. to 5 a.m. So it is during night, the lockdown. Okay. Which usually in Ramadan, usually the people, they usually go out after iftar during
exactly. That's what we were just talking about. How you normally don't sleep at night.
Very helpful.
Yeah, so that's really interesting. So people now, in a time that it's generally about family and getting together with friends, now they're confined to their own house, but hopefully they're with other people in lockdown at home. So we have another question, Dr. Yassin from LinkedIn, from Ismail, and he wants to know, are you collaborating with any other NGOs in your COVID response?
Yes, you know that, that as Red Crescent, we usually have a certain cooperation, coordination mechanisms with movement partners. And that's what's in Iraq. We have so many partners now working with Iraqi Red Crescent, IFRC, ICRC, many national societies, and we all together supporting the Iraqi people in these hard days. Also, we communicate and we cooperate usually with community NGOs. And we usually exchange information with these community NGOs regarding the vulnerability. And we also seeking the assistance and sometimes in vulnerability assessment, they can also provide us with links with community leaders. So we use these NGOs, local NGOs, as a bridge to reach communities which maybe we cannot reach in certain places. Of course, and as for Iraqi Red Crescent, and I would like to say that very well, this have very well a presence all over the country, and we usually have very well acceptance among, because of the history and the services we delivered throughout our history and the high reputation we have. But we don't neglect any support or any attempt to support from the communities, whether individuals or institute as NGOs.
So that's really interesting. And when we're talking about communities, I had a question about misinformation or rumors, and working with communities to understand any of those misinformation or rumors. Have you been working with communities to understand and to combat misinformation? And can you give us any examples? Can you think of any?
Yes. In Iraqi Red Crescent, we are very much respecting the principles of Red Cross Red Crescent, and we are acting accordingly. So any information we receive, we respect any information we receive, but we do our surveillance. We do our field assessment for any information, and by this way we respond, and our response will be direct to the beneficiary. We don't use usually middle agents for that. We go directly and we support them by visiting them. In many cases, we visit their houses. We sit with the family. We talk with them. We assess them, and we support them, and we respond to their needs. This is the way we are doing. We have a direct, but sometimes some of the NGOs, they voluntarily provide us with some information, and we, of course, some credible NGOs, even those credible NGOs, we don't take it as it is, the information. We should do the assessment ourselves and to be sure that they are really, those families really vulnerable, they're really in need, and to respond according to our principles, you know. Yeah.
Right. But how about misinformation regarding COVID? So if there have been any rumors about how it spreads or rumors about how you can cure yourself from COVID, have you heard of any crazy rumors that have been spreading?
Yeah, and that, you know, we are dealing with the rumors in one way. We usually advise the people not to listen to anyone. You should listen only to authorized public authorities.
Right.
This is the only way to get the right information. You should all the time block your ear. You don't listen, you don't read, you don't communicate those non-accredited sources of information. The only accredited source of information is the public health authority. This is the only way to get the right information, because you know now with the social media you get so many information and false information. You got misleading. You got everything which may cause many harm for you. So you should not go. You go to the source of for information from the authorities, and this is the best way. So we don't publish advices for COVID. We just call the people, listen to health authorities. That's what we are calling them. So, or we convey their publications to the authority, to the communities.
It's so important. Like you said, right now with social media, people are sharing so many rumors. There's so much misinformation going around. And I think that's one of our really important roles as the Red Cross and Red Crescent is to help, stop those rumors. So I want to just ask one more question before we close out. Do you have any final words or any stories, anything you want to say to the volunteers out there that are responding to COVID right now? Everybody needs a little motivation, you know, if there's anything that you have, any last words that you wanted to give.
I'm really highly appreciate what the volunteers all over the world, the Red Cross, Red Crescent volunteers, whom they usually responding as a first line responders, whom they usually sacrifices their maybe some in certain cases their lives or their precious time and leaving their families behind and going to the field responding to the population needs. I think in this way we should the best gratitude from response from the population is by restricting their movement, respecting social distancing, and respecting all the health authority advices to keep or to combat this pandemic. This is the only way we can express our gratitude to those volunteers whom they doing their best to support you and to save your lives.
I completely agree. You have to do what you can, do your own physical distancing, and be safe for yourself so that you can support the people in the front line so they don't have as much work to do, right?
Yes, and I think, Melis, this pandemic won't be for a short time. It will be a long term, yes. And we should, in this case, we should change our life to live and to combat this disease, because it is impossible to stay in lockdown for longer than what we have now. We should return to our normal life, but a normal life after COVID-19 is different from COVID-19 normal life before.
Exactly.
We should be used for the golden advice, which is prevention. We should also follow this and respect this social distancing and become a new trend for our life. This is the only way I think we can, in this case, combat this disease.
I agree. Thank you so much for joining me today, Dr. Yassin from Iraqi Red Crescent. Join us. We have another live coming this week and more next week. So every week we're going live talking about COVID in different places around the world. So today, again, this was Dr. Yassin Abbas from Iraqi Red Crescent. Thank you so much and have a great afternoon, evening, good morning to everybody that tuned in.
Thank you very much.